Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. I hope you had a wonderful weekend and excited for a action-packed, work-filled week ahead. There are several things that we're sharing in the Monday Morning News about the new transparency rules that are directed to employer groups. Tens of thousands of employers who buy insurance coverage for their workers will get this more complete pricing picture and may not like what they see. As of July 1st, health insurers and self-insured employers must post on their website just about every price they've negotiated with providers for healthcare services, item by item. Now, there's an article that, says, is this going to show them that they're not getting a good deal? Show employees they're not getting a good deal. I guess the devil's in the details. First of all, how is that going to happen? How are they going to be transparent? It does go into effect July 1st. And it is, do not forget, it is directed to insurance companies and self-funded plans. So if you have self-funded plans, you might want to, make sure you understand these new rules and that you're helping your clients adhere to this new law. So basically, it also says that employers must provide a machine-readable file to the public, which will show in-network insurance rates, out-of-network charges, and information related to prescription drug coverage. Now, this is very complex. It's not something that's easy. It's already in effect, July 1st. Is it working? What does it look like? Has anybody adhered to the law yet? I'm sure that they have, but we need to make sure that we can be a resource to our clients. And this is something that we're learning more at HAFA about, and we'll be providing more information. In 2022, the new affordability percentage is 9.61%. So 2022, 9.61% is a decrease of 0.22% from 2021 of 9.83. So something actually went down. I'm not sure that that's really something that we could be excited about, but it did change. A lot of you probably have gotten a survey from the Henry Kaiser Family Foundation, and I encourage you to complete it. It takes about 20-25 minutes, but it asks some important questions that I think they need to know about agents and brokers. And one of the sections that I found very interesting is directed to this new Medicaid switch. And I'm going to call it a Medicaid switch. So what's going to happen is all those folks that are on Medicaid now, they make too much money. There will be a day when the federal government says the switch is turned off and everyone will have to go onto a marketplace plan if they do not, if their income levels are not within the Medicaid realm. So what that does is the federal government flips the switch, then the states are given the opportunity to flip their switch. So this is not going to happen, overnight. The government's going to make a decision, the states are going to make a decision, and then each person will be given an opportunity, 60 days, to enroll in a marketplace plan. Now, I've said this in the past. Everything I read, CMS is saying, we're looking to the navigators. Well, these questions kind of want to know what you're doing as agents and brokers. How are you going to respond to this switch? And what I'm going to tell you is if you work in the individual market, you absolutely want to be the go-to. You want to be that boots on the ground. How are you going to do that? Are you going to do it through local media? Are you, and this is one of the questions in the survey, are you going to reach out to your Medicaid office? Which I absolutely think you should. I think you should offer your services. Do I think they're going to allow that to happen? My ESP, and it's not always right, but my ESP says no. One of the questions is, do you think the Medicaid office is going to give us a list of those that are coming off the Medicaid rolls? No, I don't. But I think that we need to do our due diligence, and we need to offer our services. So if someone says, hey, did you offer your services? Absolutely. Did they give you a list? No, indeed. But we need to make sure that they're not giving a list to the Navigator programs, and that's something that we'll have our eye on. We want to make sure that we are there. However you want to do that, reach out to your Department of Insurance. Maybe your Department of Insurance is going to be involved in this in some way. You need to make sure that we are the answer, that we are the professional, licensed, educated person that is supposed to help everyday Americans choose a plan that's best for them, not a government-run entity. Okay, I'm going to back that up because I'll get in trouble. It's not a government-run entity. It's government-funded entity run by private entities to provide insurance. Now, they'll say that navigators enroll. They do not sell. I don't care if you say it enroll, sell, whatever. We're all paid. So when they say navigators are free, absolutely that's incorrect and not right. They're paid. They're paid through government grants. Insurance agencies, insurance companies pay us through premiums that are built into premiums. Everybody's paid. We're not working for free unless you work for some of these insurance companies who in the past have thought that they didn't have to pay insurance companies. But however, recently CMS said, nah, not gonna happen. CMS is having a webinar this week about commissions. It's such a breath of fresh air, because if you've been a HAFA member for many, many years, this has been something that we fought for. This is one of the main reasons we started HAFA, was so we could fight for a fair wage. And I was told over and over and over, Ronell, you need to go to Capitol Hill to get this changed, to get a spotlight on this issue. And I did, year after year after year. And Capitol Hill always had something better, more important to address than the individual agent getting paid a fair wage. So to see CMS take this on is just a blessing. It's taken, HAFA turns 11 in November. We started November 2012. So actually we turned 10. So 10 years, this is how long we've been fighting. So those that say, you need instant gratification, sometimes instant gratification doesn't come. Sometimes it takes year after year after year after year of fighting for something and getting results. We've got results. We have got results. And HAFA was on the forefront. Don't ever forget that. A lot of you sell Medicare. Our HAFA members sell Medicare. New Medicare rules say that we have to record our conversations with our folks about Medicare Advantage and Medicare Part D. All agents are confused. There is a petition out there trying to get CMS's attention to make some changes to these rules. I'm not telling you to sign it. I'm telling you to check it out. Basically, we're unsure exactly how it works. How long do you have to keep these recordings? Does our E&O cover the fact that we're recording HIPAA information? There are so many pieces and parts that we're very confused about, that we're trying to get to the bottom of it and trying to find out for you. I've been asking folks to do webinars for us, and very interesting, because I guess I wasn't thinking clearly, but I should have been. I reached out to our Louisiana SHIP program and asked them to do a webinar for us on these new rules, thinking that we all play on the same team, but we don't. In having this conversation, I'm not sure that they will have to record their conversations. They do sell insurance just like we do. They do assist seniors just like we do. But I'm not sure that they're going to have to adhere to these rules. So therefore, if they do not, they're not a good source, a good avenue for me to get someone to provide a webinar for you. And because there's so many unanswered questions, I'm not sure a lot of people want to provide a webinar yet until we've addressed more of these questions. I do have a call with CMS this week. It is one of my questions. Because this is a federal marketplace call, I'm not sure, I can almost guess they're not going to have an answer for me, but at least I'll put a bug in their ear that we want answers, we need answers, and we need an avenue to be able to help us. A lot of you remember that work in the individual market that tax credits were expanded. Last year, beginning of the year, during COVID, we rewrote all our individual clients to make sure that they got more of a tax credit. Those expanded tax credits were getting ready to go away. And what we're reading in one of the articles in the newsletter today says that premiums are expected to go up 50%. So get prepared. That could be a huge problem as you're enrolling starting in November. The other thing while we're talking about open enrollment is the commission transparency rules for individual. The final rules are still not out. That's another item that I've put on my CMS list to talk about. One of their proposed rules says insurance companies may ask us to disclose commissions on individual. The law clearly says, the NAIC clearly says the law is directed to insurance companies. Most insurance companies are already doing it. They should have been doing it December 27th. United Healthcare did issue a memo saying that they were not going to do it. They were going to require us to disclose commissions. We're not sure I can say United Healthcare is not adhering to the law. If for some reason CMS issues final rules and they say that we could be asked, then United Healthcare would be adhering to the new CMS regs. But right now, they're not adhering to the law. The commission transparency on the employer side. Read my lips. You better be disclosing commissions. Hope you can see me and my lipstick. You better be disclosing commissions. 12/27/2020 when the law went into effect. Every employer group you have going forward after 12/27, you need to disclose the commissions. What HAFA did was we worked with and still work with our partner Dicers Law out of DC. They created a very concise form for you to use. As HAFA members, it's $75 unlimited calendar use. A year use. Because if you signed up today, it would be good for a year. $75, unlimited. If you have one client, it's worth $75. If you have 100 clients, you're getting a kinfolk deal, big time. So you need to make sure that you are doing that. Very simple. The form is simple. Fill in the blanks. Remember that the commissions is perspective. What do you think? Especially come in regard to bonuses. What do I think my bonus is going to be? And then you're given 60 days should there be any major changes that you respond back to your client and let them know. You want to make sure that your client signs that and sends it back. In the very beginning, we said it, HAFA said it, our client said, our partner said it, Dicers Law said it, have your client sign this form. Some of the other associations in the beginning said, don't sign the form, no big deal, don't worry about it. They have since changed their tune and they say, sign the form. Sign, have the form signed, returned to you. Have it for your use. Remember that when you use the Dicers form, one form is kept in the Dicers law firm. So if you ever have any problems, you do have the backing of a DC law firm, which is very important, worth way more than $75. I wanted to let you know that Agent Summit, the $100 discount ends July 15th, ends Friday. So you need to register today to save $100. You do not want to miss this summit. I am so excited about the speakers, the folks that are coming in from all over the United States, whether you work in the employer market, whether you work in the individual market, whether you want to learn how to work with your team, whether you want to be motivated. We are extremely excited about the folks that are coming and our sponsors that are going to be in the room with us, that you're going to be encouraged to meet, and you will be excited to meet, I promise. We're working on CE. Again, in order to get CE, you need to register before the 15th, number one. Number two, it's really going to come down to how expensive it is in your state. In some state, filing CE is very reasonable. In some states, it's $100 per CE hour. So if I have one or two people coming from your state, it is cost prohibitive for me to do CE, but I will let you know. Wednesday night, we're going to have an amazing party in the penthouse suite that you're going to meet the speakers, the sponsors, Dean Mose, and then Saturday, black tie affair, ladies in your dresses, men, whatever you want to consider black tie is, whether that's tux, whether that's any other form of dress. We are excited to have you regardless. It will be a full casino night, a fundraiser for the HAFA pack, blackjack, roulette, craps. You're going to have a blast, I promise. So full day Thursday with breakfast and lunch, half a day Friday with breakfast, hot breakfast. I was told a long time ago by my HAFA members, we do not want any cold croissants and coffee. We want hot, sustaining breakfast. So you get hot, sustaining breakfast. I am very, very excited. I'm flying up to Nashville on Monday to do a site visit, to sit down with the 21C Museum where we're going to have our conference and work out the last minute details with them and see what we need to do. Also a site visit with our casino folks to show them where we're going to be and talk about some last minute ideas with them. Proud and honored to represent the HAFA Freedom Fighters, the cream of the crop. We're here for you. You let me know if you need anything. I promise I fight day and night for you. Until next Monday, have a wonderful, wonderful week.